Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, and here from the JWC studio, I've finally got the great Dr. Sachin Kulkarni here.
Hello,
I've
namaste.
been with, thank you for being here. I've been meaning to talk to you for a long, long time for a topic that you're, of course, an expert on, and that is IVF and fertility. So, thank you so much for being here, Dr. Kulkarni.
Thank you so much. It's a pleasure to be here.
So this is a topic that obviously a lot of people are very keen to know about. It's becoming more and more popular, especially in India. So let me just ask you, the first question would be, what is IVF if you had to explain it to a fool like myself?
Yeah, I feel that IVF got very popular as a quick fix to get a pregnancy,
Yeah.
and that has been going for last 4 decades.
Okay.
And slowly we have seen an industrialized IVF practice getting established all over the world,
Right,
not
right,
just in
right.
India but everywhere in the world. But I wouldn't like myself to be called as an IVF consultant.
Okay.
I would prefer being called as a reproductive medicine specialist because
Okay, I
not
like
every client coming to me requires an IVF.
Right.
What we require to do is a thorough evaluation.
Yeah, yeah.
No, only the prescribed ones would go for IVF.
Okay.
So IVF is essentially a process called in vitro fertilization and embryo transfer. So it's IVF and ET is
Yeah.
short form. And it started with the birth of Louis Brown in 1978 in England.
Right.
But trust me, Dr. Steptoe and Edwards, who discovered the whole thing and had the first baby born, they had 19 failed attempts prior to that. So
Okay.
it's not a very smooth, successful
Yeah, of course.
story for
Right, right,
everybody.
right. Yeah.
And though the science has evolved much more today, and its popularity is basically it's because it's a shortcut and a quick fix for many couples who don't have that kind of a patience.
Right.
So this is a quick process wherein the lady is given injections to
Is it,
develop.
sorry to interrupt you. Is it just patience or is it also inability?
Yeah, that's also there.
Okay.
That's also there. Yeah,
Right.
both sides. And many times it's not. Basically, we see a lot of healthy couples. They're not deceased.
Yeah,
But
yeah.
they have a desire of having a baby faster.
So it's more planned.
Yeah, it's many times planned as well.
Right.
So quickly, the process has three parts. The one part is the stimulation part, wherein the wife receives injections for a period of 10 to 12 days, which are below the skin, they're practically painless, and they don't have any side effects as such. And nowadays, even needleless injections are also available. So it's very comfortable now.
Right, right, right.
At the end of 12 days, she develops multiple eggs in her ovary,
Okay.
and then they are taken out. The taking out of the eggs procedure is called ovum pickup. It's again a very short procedure where the client generally comes in the morning in the hospital, gets the procedure done by afternoon, they're home. And there is no stitch or scar on the tummy. It's done through vagina under a simple anesthesia. And the anesthesia is also very quick.
Okay.
At this end of this procedure, we get the eggs. Then we start grading the eggs, and we also get the semen of the husband at that time.
Yeah.
And then the sperm is cleaned, and the robustly motile good sperms are separated, and we get the good eggs. And we do a procedure called ICSI, intracytoplasmic sperm injection, where we put the sperm in the egg. So that is all in the lab.
Right, so it's done like a
the
third
first,
place.
First step is the injections and the egg pickup. The next is everything happens in the lab. So every day we keep in touch with our client on telephone, telling them, well, your embryo has moved this way,
Yeah.
especially on day 3 or day 5, and tell them how many embryos are formed. And then comes the next step, is putting the embryos back. And generally nowadays we don't put the embryos immediately as they are ready, but we freeze the embryos. We take a time of a month or two. As I told you, they're healthy women.
Right, right.
So we don't want to put anything artificial. We go by the nature. We develop our own egg by nature. And as the egg develops and ruptures, we put the embryos back to their uterus. So that gets us a better pregnancy.
So you're basically just facilitating a natural process. It's not like
Absolutely.
anything that's artificial or anything like that per se.
Yeah, there's really nothing artificial. It's for quite a natural process. Only thing, the whole natural process, instead of taking place in the fallopian tube, is taking place in the outside traditional incubator.
Okay.
That's all.
Right, right. I mean, there's so many places I can go to asking questions for. This might be an offshoot of that. It may not be exactly related. But another thing that, because you mentioned freezing, so it reminded me of another thing that's becoming more and more popular, and you can give your thoughts about that, is things like eggs freezing.
Oh, yeah, so true, so true. Even egg freezing and I'll go a step ahead, even sperm freezing and even ovarian tissue cryopreservation. So all these three things come under a bigger topic of fertility preservation.
Right, right.
It is chosen for various reasons. Somebody could be, he's an army man, is going to be out on posted in Africa for a year's time.
Yeah, yeah.
And definitely his wife can chase pregnancies here if he gives some samples back here. That's one way of, or I've had patients who have had testicular tumors. So before they went on for surgeries for testicle and or taking chemotherapies, they're given semen samples with us.
Okay.
And then they have undergone the surgery, taken chemotherapy. After 7 years, when they get married, I've had a couple having pregnancy of the sperm which is preserved 7 years back.
Wow. Does it last for that long?
Yeah.
How long does it last for?
No. The cryopreservation process is very, very robust.
Okay.
People have achieved pregnancy after 2 or 3 decades of preservation. Even for the embryos.
2 or 3 decades?
Absolutely.
Wow.
Even for embryos, even for 1 decade of cryopreservation. Nowadays, we call it vitrification.
Right.
It's a very robust procedure.
Incredible.
Not only the procedure is quick, but when we recover the embryo, 99% of the times the embryos recover very well. So
fantastic.
That robustness has definitely made a lot of difference to the whole caregiving of the IVF process.
That's really incredible.
So fertility preservation is one is the sperm.
Yeah.
And then there are a lot of women who would be chasing careers or going abroad or they want to just want to get settled. I really don't know what the definition of settlement that differs from client to client.
Absolutely right.
And then there is always a kind of controversy where the parents are telling, well, please have a baby faster, and the girl is saying, no, it's not a right time for me to get married as well.
Yeah.
So that thing goes on. So the best alternative for these things is to go for an elective egg freezing. So if you do an elective egg freezing between, let's say, 30 years to 35 years, or let's say 28 to 35 years, you're going to get the best number of eggs, you're going to get best quality. What I mean by quality is when you make a baby, there is less likely that baby will have a genetic problem.
I see.
But if you think of getting preservation done at 37, 38 years of age, your eggs can have a genetically problematic babies there, or the embryos may not form well for that matter. So at a right age, preserving eggs is pretty a must out. Today, just now I'm seeing a client. They came from US and they're just here for another 15 days. And there I find her anti-Mullerian hormone level low, or the egg reserve is low, but she's 33. And the husband is 37. So I requested them, do go back, but do plan to come back faster in 3-4 months. You can go for one embryo preservation round. Then the embryos will be with us, and then you can complete because she's just taken an admission for PhD. So I said, you complete your PhD and you can come back and take these embryos. So it's, both the things can go hand in hand, and you can look for a planned parenthood that way.
I'm so glad that you're bringing this topic up, because it's from the egg freezing, what I was thinking of. And then you brought up the social aspect about people saying that why don't you have your child now, or this third aspect about age and so forth. And what I was thinking in the back of my mind is that you see today more and more people seeing, whether it's on social media or wherever it is, this thing about this biological clock, especially for women. So it's creating a lot of anxiety, pressure, and so forth. So what are your thoughts on that?
No, there definitely is a biological clock. Beyond the age of 25 years, the number of eggs in the ovary keep on coming down. And by about, the average age of menopause in India is about 47.2.
Right.
So about, you can say about 6 or 7 years prior to that, about 40 years downwards, the anti-Mullerian hormone and the number of eggs have come down to an absolute nadir.
Right.
And it's such an unfortunate situation in India. And I feel this could be because of our high carb diet, or maybe because we are cardiometabolically bad, like obesity and diabetes and blood pressures are very high in our community. And maybe the kind of chronic stress, maybe economical, or we just have a lot of aspirational stress, don't you think so, compared to the rest of the world?
Yeah.
And that stress keeps on mounting up. And even when I shared our profile of our Indian women with the American women or the other consultants, they said that, well, Indian women typically have much lower ovarian reserve. So an American woman at about, let's say, the age of 34 or 35 will be able to give you a decent number of eggs, but very few Indian women will be able to do that. There's a side effect. I don't really can attribute it to fertilizers or pollutions. Really don't know the exact reason. But there's a SWAN study which is published. It's a study of women across nations. That's the SWAN studies. And where they compared the Indian women ovarian reserve for the Spanish women. And they realized that the Indian women ovaries are 7 years older than the Spanish women for the given age. That's a pretty sad thing. So the biological clock definitely exists, but it's worst in India. So we need to be very aware about it.
Yeah.
And then take
But
action electively.
hopefully it's not all doom and gloom. There's a lot of things that hopefully we can do to improve that, and to keep that healthy or prevent certain things. What are your thoughts on that?
So true. First is getting a correct information on where do you stand in your biological clock.
Yeah.
That's the first information. And definitely you can do lifestyle measurements, and especially I would insist on certain dietic interventions.
Right.
Like, if you look at preservation, the ovarian reserve, the few diet measures would definitely help. For example, lemon is good, garlic is good, green vegetables, and not having a lot of fruits like apples and big fruits, or even for that matter, potato and sweet potato, because a lot of organochlorides are there, and they can affect your ovarian reserve.
Okay.
So no, I would say go with almonds are good, or pumpkin seeds.
Okay,
These are good things in the diet, and that could preserve your ovarian reserve for a longer time.
Okay.
And obviously some kind of an exercise. Exercise especially which can improve your pelvic blood flow.
Oh, so you're actually doing physical
exercise, like Kegel's exercise, or Kapalbhati for yoga, or cat and cow exercises,
why is
or
that
butterfly.
Like, how will that help your...
If your your blood flow increases, your uterus is more healthier, the endometrium lining is better, your ovaries will function better.
Yeah.
So it does make a difference, all these things.
Oh, interesting. Well, I'll go back to one thing that you first started by saying, is that to check your biological clock. So what do you mean by that? What does someone check? What do they do?
Yeah, I think we need a very holistic evaluation of biological clock, and I would start first by the history. If your mother or your maternal aunt has had a menopause less than 40 years of age, you definitely stand to have an early menopause.
Okay.
So these are the women who should get more conscious about getting the test done. And the test, I would say, is on first 2 or 3 days of the menses, you should go for an anti-Mullerian hormone blood test, a blood test for FSH and LH levels, and a sonography to find out how many eggs are in the ovary.
Okay.
Because there is always some discordancy between the AMH level and the number of eggs. Because AMH is a global picture, it's a blood picture.
Right.
But AFC, or what we call the number of eggs, that's actually the local picture available that day.
Okay.
So the AMH and IVF. So a lot of women come to me saying that, well, my doctor, my AMH is low and I'm worried. And when I put the probe inside and see the number of eggs, they're good. They're about 6 or 7 eggs. And I said, don't worry, you still can achieve a pregnancy.
Interesting. And what about men? What can men do?
Oh yeah, men are different.
Men are very different.
Yeah, very different. What happens is, sadly, the women have a fixed quota of eggs. That's about 3 million eggs at birth. And, only 400 of them actually ovulate. And there's a constant deterioration of the number of eggs through the life. While in men, the production of the sperm is a continuous process. They keep producing new and new sperms through their life.
Yeah.
So there's nothing like the sperm going down. It can go down because of some injury, some illnesses, obesity, or some hormonal problems, or tumorous situations, infections, etc. But in a normal man, the sperm count, if it's a good sperm count, it's not going to go down with the age. Only thing is, beyond the age of 45, the sperm can have a baby which is having some genetic issues. So it's better to try to have a baby before your age is crossing 45 years.
Even for
the man. And beyond 53, definitely the chances of congenital anomalies in the baby do increase.
Okay.
So the men need to be conscious there as well.
Okay. Interesting. So until 45, I can get rid of people who keep pressurizing me to have babies
provided a semen analysis normal, yes, you can do that. Okay. But I think I would say not everybody is bestowed by that. You're good because you're exercising, you're having a healthy diet. But I see so many men, and I call them suffering from diabesity.
Obesity.
So diabetes and obesity together.
Is that something that you've? Is that a coin?
No, it's not coined by me. It's a very known word in Indian doctors.
Okay.
So because diabetes starts about a decade early in Indian population.
Right.
So imagine at 30. About 20 to 30% of the men could be diabetes. On that, the aspirational stress and that stresses. So typically they will have a paunch because of lack of exercise and high carbohydrate diet. It's not about how much carbohydrate you eat. It's more about, I feel, how frequently you eat. Isn't it?
Right.
Very frequent. And that comes together. Now, your diabetes, your obesity, with both the oxidative stress in your body goes up. So that starts affecting your testicular function. And now you're sitting on a chair for a long time, creating a warmer environment, and the testis is to be in a colder environment.
Okay.
So you're sitting in a chair for 6-8 hours, in a car for another 2 hours.
Wow.
So for that 10 hours a day, you're having a warmer environment around the scrotum and testis over a period of, let's say, 10 years.
Wow.
Definitely that's going to
Yeah, you've created a perfect storm for yourself.
That's what happens.
Okay. Well, shifting gears a little bit to, we're talking about so many different aspects of this. I mean, you can imagine through your experience, it must be the journey for a couple or an individual who wants to do this. It must be so emotionally, up and down, and can be lovely because of the birth of life, or the life of birth. On the other hand, there's, situations where, as you said, there can be cycles where this isn't successful and so forth. So it can be a huge range of emotion and financially tolling for people that have to go through this. And, as you said, this is becoming more and more industrialized, and especially in India. I'll ask you straight up. Obviously there's an aspect of ethics that, that's involved, that is unfortunately starting to crop up in this space as well. What do you do as a doctor to give the most comfort to a patient or to a couple that's coming to you, or an individual that's coming to you, that yes, this is the sort of the safest path, or the right path for you, and yes, we are going to take care of you?
Correct. It is complex, no doubt about it. So our consultations do last for 40 minutes sometimes, maybe 1 hour.
Yeah.
Because I think most of the time we are listening to the couple and understanding their issues. And there could be emotional issues and economical issues, etc. And we call in Jehangir Hospital as fertility coaching. So I think we are just not physicians. We are also mentors for the family. We cannot forget that role of ours when we are a couple. So, we do spend time coaching them and, asking their even mothers and mother-in-laws and fathers to meet us, so that we can tell them, well, you're in good hands. And these are the evaluations. And well, they feel very anxious as well. And that
there must be a fair amount of counseling involved.
Yeah, I'll give an example. This lady, we always ask them a very proactive question. Please tell me, what's your stress beta? And she said, well, as I'm going to go home today, my mom will make a phone call and say, well, what did the doctor say? And that's a very stressful question. So I had to invite her mom and said, please don't do that. And, that's giving a stress to her. Don't worry. You make a phone call to me or my team. We will answer you. But there's no need to trouble her. Just give them that free space and coveted private space of theirs to chase the pregnancy.
Okay.
So that's fertility coaching is very essential, I think. Now, coming back to your question of ethics and what ideally should be done to get the best pregnancy rate. That's two different ones. Let's answer the ethics ones.
Right.
Because of industrialized practice, and there is a stupid competition, I sincerely call it a stupid competition of going low on the rates. And then you suddenly increase the cost of treatment halfway through. And patients cannot do anything. You're advertising, well, we will do it at 60,000 rupees or 90,000 rupees. And they go prepare, well, it will be varying by 10 to 20%. But after end of 1 month, 1.5 months, they come out spending 2.5 lakh rupees.
Yeah, exactly.
So I feel that's where the transparency is not there. So I think when you choose a clinic to do IVF, most importantly, to look into transparency. So let me give you some examples of what qualitative transparency we keep in Jehangir Hospital, Jehangir Clinic. So we basically inform them the whole physiological part, then why we're doing IVF, what are going to be the steps. Then we say what could be the surprises, which we will come to know only when we start treatment.
The process,
and how we are going to deal with the surprises. For example, getting less eggs, or the egg not forming into a good embryo. What all we can do so as to improvise, rather than doing it retrospectively in the next IVF cycle, which is another some amount of money. It's better to do everything possible in the first cycle.
When they're already emotionally...
Absolutely. So we feel a well-informed client is very well desired by us. So we see to it that they're counseled at multiple levels. Like we have video sessions with them. We have videos on YouTube which they can look into in Marathi and English. They can look into those videos and get educated. And we just keep telling them about each and every process. Again, let me give you, like when the eggs come out, we literally draw the figures of the eggs on the paper and tell them, well, this is maturity and this is immaturity, and how we could prevent it. Like we draw them the diagrams of embryos and tell them what is the grade of your embryo, etc. And that transparency really develops a trust bond between the client and the doctor.
Absolutely.
And that trust is the one which basically takes your stress down.
Absolutely. And that's such a big factor for...
That is the most important, I think. So it all starts with transparency, giving loads of information, get a well-informed client,
Yeah.
come on the page with that client. Let it
Right,
be a
right,
Marathi-speaking client or a Hindi-speaking or a Gujarati-speaking or English. Not everybody is going to be fluent in English, but we have to speak to
Relevant.
them in their own language and come to that. And then the trust bond starts developing. And then you put your foot into this. Like today morning, I had a IVF procedure where, I had to take sperm out of his testes because he has zero sperm count. And I had to take eggs from the lady.
Okay.
So we took the eggs from the lady. We got about 18 eggs, and I assured the husband, "Don't worry. From all your scientific criteria which we have put in, I'm sure we will get sperms." He was very anxious.
Yeah.
Where he'll get so many sperms.
I would be too.
But at the end of it, they got it.
Wow.
And when I went back to the rooms and telling them, well, you've got sperms also, we got the eggs also, don't worry, we're going to go the procedure. And after this interview, I'm going to go back and see them as well.
Good.
And they said, they literally had tears in their eyes.
Yeah, absolutely.
They said, we have not got a baby, but we know that we are at a good place and at least we are moving forward.
Yeah, absolutely.
I think that makes a difference. So giving information in a correct fashion makes a lot of difference.
Yeah.
That's one thing. Now, from the stress point of view, it is a stressful treatment.
Yeah.
So I always teach my clients that, you don't think of having a baby in your hands immediately. Think of, let's win each battle every day. Like you form good eggs, one battle won. Okay, we got the eggs out, good mature eggs, the second battle won. So let's enjoy those small battles. And that progressively keeps you in a long-term positive thought.
Absolutely, yeah.
Otherwise, what will happen? Will I get a baby? Every time, will I get a baby? Will I get a baby? That is just...
You're compounding your problem.
Unnecessarily, you're getting the negativities. So we make them participate in this positive thought process and then it goes smoother.
Lovely.
Even at the end of the day, suppose they don't get a pregnancy. So what we have done at Jehangir is we see to it that they're stimulated in such a fashion that we have multiple eggs with us and multiple embryos. So even if one cycle fails, we could have spare embryos with us. And we can do a second cycle without making them spend just 1/3 of the money. So that makes sense. So one major change which is giving us a very high success rate has been a single euploid blastocyst transfer. Well, let me just tell you that. What is it? Yeah.
Big word.
So a single means you're just trying for one baby because uterus is meant for one baby.
Right.
We are humans.
Yeah.
Animals' uterus are meant for multiple babies. The humans are meant for one baby. And that is more successful. It will go to 9th month. Although you have twins, you may deliver in 7th month.
Yeah.
Euploid. Euploid means genetically normal. All of us are living on this earth because we are genetically normal. Then why not select a genetically normal embryo and put it to the uterus? Obviously, your chance of pregnancy is going to be good and your survival rate is going to be good. Your chance of abortion is going to drop down.
Yeah.
Now, look at that you have 4 embryos. I have done a screening and I find 2 are genetically normal, 2 are bad.
Okay.
So I'm not transferring those 2.
Right.
So you're not going through a negative experience. Your negative experience has gone down. Now you're going to transfer 1 euploid embryo. And even if it fails, you have another euploid embryo to go where the pregnancy rates are 70 to 80%. So let me quote you a study. These are studies done by Paul Pirtia from Boston IVF. And he published this in, I think, 2023. He looked into data retrospectively. I looked at all the women who have taken 3 euploid embryo transfers, 3 single euploid, and the success rate was 92.8%.
Wow.
Now, without doing such a thing, if you just advertise on the hoarding that our success is 80 or 90%, that's sheer stupidity. That's where I think ethically you're not going out.
Well, lovely to hear that kind of thing.
So at Jehangir, we are maximally promoting everybody, especially the women beyond 35, that please go for a PGTA tested euploid embryo transfer. It makes all the sense to go for that to achieve pregnancy.
Lovely.
Oh, sorry for that long answer.
No. I think what you said is extremely important. So I think it's good for everyone to hear that. Final question then in this huge space. I mean, we can talk for hours, I think, about this, and maybe we'll do that on another episode. But what are the biggest myths that people come to that you feel that you need to, bust?
Oh, yeah. Even after so many decades of IVF practice, I still have couples inquiring, "Hamara hi hoga na?" I think that is sheer stupidity. I feel it's always gametes are their own gametes.
Right.
And if you have to use donor gametes, a proper consenting, well information is always done,
Right.
It is never that way. That is one. Secondly, IVF is painful, but gone are those days. All the injections are below skin. We don't give anything in the tummy.
Okay.
Then a lot earlier time, and a lot of these industrialized IVF practitioners, they give a loads of injections after the pregnancy is achieved. And that
okay.
cost is never explained, and that can go to about 70,000-80,000 rupees a month.
Again, that makes sense.
So in Jehangir, we do natural cycle embryo transfer. So we allow the egg to develop, rupture it, and then develop.
Right.
So our medical costs will go beyond 7,000 or 8,000 rupees a month.
Okay.
Okay, that's a huge difference. And again, the pregnancy rates are higher because you're going with the syncing with the nature. So loads of injection, that myth is busted at our practice, that we're giving as minimalistic as possible. But that's what will make them more comfortable and increase the friendliness of the couple.
Okay.
So that's what is done.
Well, lovely, Doc. I think it's been absolutely fascinating hearing from you about this topic that, as we've been saying, is a very popular one and very important one for people, and obviously very close to people's heart because it's obviously giving life and so forth. So thank you so much for sharing your views. Any final thoughts that you'd like to leave us with?
Oh, thank you so much for the invitation as well. And I feel it's an emotional journey for us also as a doctor.
Yeah, absolutely.
Somebody is doing an appendectomy. It's a technical job. I feel I'm not keeping them down. Don't misunderstand me. But for us, it's an emotional journey. We feel equally sad when somebody doesn't get a pregnancy, and we feel equally elated when somebody achieves a pregnancy. Because I always tell couples that you could be having a lot of money in your bank, but once the baby is born, you think, well, I'm going to use that money for my child's education abroad. No, I call it, वो पैसे को meaning आ गया कुछ तो. Otherwise, it was just some lakhs lying in the bank.
Yeah.
It was increasing, but there was no meaning to that. Now you're given a meaning to that. It will be used for my child's education. So I feel it's a huge emotional journey, and it is both and I'm lucky that I'm a gynecologist and an IVF clinician.
Okay.
Because I love to enjoy these emotional things with every client. So I think when we move on the roads or hear the advertisements and watch time, it's always said about, I would like to be a mother, or cherish your motherhood, or complete your motherhood. But I feel in the society, we subtly attend to, I want to be a father. It's equally an intense emotion. So at Jehangir, we say that parenthood is possible because I think the baby is enjoyed by the whole family. So we have our different means of going towards that journey, and we would love to take you through and handle you in every aspect of that treatment. So parenthood will be easily possible when you tie up at Jehangir Hospital.
Well, thank you for being on this journey with us, and I'm sure you'll be there for many, many couples and individuals as we go along into the future.
Thank you so much. Such a nice day.
Thank you. Thank you, everyone. And do not forget to hit the like and subscribe button here before you leave. And please join us for next week's episode. Thank you.